The medial collateral ligament, MCL, is one of the four major ligaments that support the knee joint. It runs along the inner side of the knee and connects the femur bone to the tibia bone. An MCL injury is a common type of knee injury that can occur due to various reasons such as sudden twisting, direct impact, or overuse. In this video, we will discuss the causes, symptoms, diagnosis, treatment, and prevention of MCL injuries. Causes. MCL injuries often occur when there is excessive force applied to the outer side of the knee, causing the MCL to stretch or tear. This can happen due to various reasons such as direct impact. A direct blow to the knee, such as a collision during a sports game, can cause an MCL injury. Sudden twisting. Sudden twisting or turning of the knee, such as during a sports game or fall, can cause an MCL injury. Overuse. Repetitive stress on the MCL due to activities that involve twisting or pivoting, such as running or jumping, can also cause an MCL injury. Symptoms. The symptoms of an MCL injury may vary depending on the severity of the injury. In mild cases, the patient may only experience slight discomfort or pain in the knee. However, in more severe cases, the patient may experience a popping or snapping sensation in the knee, severe pain, swelling, and limited mobility. The knee may also feel unstable or like it will give way, and the patient may have difficulty bearing weight on the affected leg. Diagnosis. If a patient suspects an MCL injury, they should see a doctor immediately. The doctor will perform a physical examination of the knee to check for pain, swelling, and instability. The doctor may also order imaging tests, such as an MRI or X-ray, to confirm the diagnosis and determine the severity of the injury. Treatment. The treatment for an MCL injury depends on the severity of the injury and the patient's overall health. In some cases, conservative treatments, such as rest, ice, compression, and elevation, may be sufficient to manage the symptoms of the injury. Using crutches and knee braces can also help support the knee and reduce pain and swelling. In more severe cases, surgery may be necessary to repair or replace the torn MCL. Rehabilitation is also an essential component of treatment for an MCL injury. After surgery or conservative treatment, patients will need to participate in physical therapy to help them regain strength, flexibility, and mobility in the knee. The rehabilitation process can take several months, and patients will need to follow a strict exercise regimen to achieve optimal results. Prevention. While MCL injuries can be challenging to prevent entirely, there are some steps that athletes and anyone who engages in physical activity can take to reduce their risk of injury. Maintaining good physical conditioning, including strength and flexibility training, is one of the most important things. Using proper techniques and equipment, such as knee braces or wearing appropriate footwear, is also crucial. Conclusion. An MCL injury is a common knee injury that can cause significant pain and limit mobility. While it can be challenging to prevent entirely, there are steps that patients can take to reduce their risk of injury, such as maintaining good physical conditioning and using proper techniques and equipment. If a patient suspects an MCL injury, they should see a doctor as soon as possible to receive an accurate diagnosis and appropriate treatment. With proper treatment and rehabilitation, most patients can return to their normal activities without any long-term complications.